A coronary artery bypass operation treats severe narrowing of the arteries that supply your heart with blood and oxygen by bypassing the blockage. The operation is called a coronary artery bypass graft or heart bypass surgery. Heart bypass surgery is carried out to relieve the severe chest pain of angina and to minimize the chances of a heart attack. Sometimes the operation may be done after a heart attack to prevent further symptoms or heart damage. This video is intended to explain heart bypass surgery as well as the meaning of coronary heart disease. But first of all, let's have a closer look at the anatomy of the heart, as it will help you better understand your condition and the operation. The heart is about the size of an adult's clenched fist. It is situated behind the ribs, which protect it, and on either side are the lungs. The heart is a hollow muscular organ and has 4 chambers. 2 thin-walled upper chambers, the atria, and 2 thick-walled lower chambers, the ventricles. The left atrium receives oxygen-rich blood from the lungs, and the left ventricle pushes it around the body. The right atrium receives the blood back, and the right ventricle then sends it to the lungs where it receives oxygen. This completes the cycle. The main function of the heart is to pump blood around the body at about 70 beats per minute. And just like any other muscle in the body, it needs a blood supply. This is provided by the right and left coronary arteries. These arteries are branches of the largest artery in the body, the aorta, and they divide to form a network of smaller vessels running across the surface of the heart and ultimately into the heart muscle itself. In a healthy heart, blood flow through these narrow arteries is free, but in coronary heart disease, it becomes restricted. Coronary arteries provide oxygen-rich blood to the heart and are lined on their inner surface by a thin layer of cells. This inner lining can be injured due to high cholesterol levels, high blood pressure, smoking, and other factors. When the layer of cells is damaged, fatty deposits begin to build up on the inner walls of the arteries. The fatty buildup reduces blood flow and eventually causes the arteries to narrow, a process called atherosclerosis. If even one part of your coronary arteries narrows, the heart muscle supplied by that artery may no longer receive enough oxygen to work efficiently. This can cause chest pain, known as angina, usually treated by medication, but this does not always prevent the pain in some patients. If one of your coronary arteries becomes blocked, blood supply to part of your heart is cut off. If left untreated long enough, this can result in damage or death of heart muscle tissue. This is what happens in a heart attack. In order to prevent this, heart surgery is sometimes performed to bypass blockages and improve the flow of blood to your heart. In heart bypass surgery, your surgeon will use healthy blood vessels from another part of your body, such as the leg or arm, and graft them around the affected areas of your coronary arteries. In most patients, one of the blood vessels used for the grafts is an internal mammary artery from inside the chest, as it best resembles the coronary arteries. This particular artery is diverted to join a coronary artery below a blockage. The grafted vessels from the arm or leg are connected to the coronary arteries beyond the narrowed areas, and then linked to the aorta just above the heart. This creates a new route for the supply of blood to your heart and bypasses the narrowing of your arteries. This procedure alleviates symptoms of chest pain and reduces the risk of a first or subsequent heart attack by improving blood supply to your heart. The bypass graft will usually be effective for many years. However, without changes to lifestyle, the new artery may also start to narrow, and a second operation may be needed.